We turn first to the City Club report on Initiative Petition 6, Public Funds for Abortion. Ryan Fox Lee, lead writer of the report, will present it and move for adoption of the report's recommendation. The meeting will then be opened for debate and vote by City Club members. Please remember that it is club policy that only City Club members are allowed to participate in the debate and vote on the report, and that club membership is open to all. Now I will turn the podium over to Ryan Fox Lee. Ryan?
May I move this?
You can move it back.
Hello. Hi, as Karen said, I am Ryan Fox Lee. I am an attorney at Schwab Williamson Wyatt, and I am the lead writer for the Public Funding for Abortion Committee. We were tasked with researching and making a recommendation on Initiative Petition 6. Initiative Petition 6 would, if it had collected enough signatures and then had been voted into law, would amend the Oregon Constitution to ban public funding for abortion. This is a ban similar to that has been enacted in 37 states. Turns out Oregon is one of the least restrictive states for abortion in the country. What the ban would have done, were it to become law, would ban any public expenditure, both direct or indirect, for abortion services. That would be both through publicly funded health plans like Oregon Health Plan, or through state, local, regional insurance carried and used for employees. The health plan, or the initiative did have particular exceptions. It had exceptions to save, so that public funds could be used for an abortion to save the life of a pregnant woman, or otherwise as required by federal law. And I'll get to what that means in a second. It also not apply to contraceptives, ectopic pregnancy, removal of a dead fetus or embryo. So what I'll do is tell a little bit about what we saw as the main arguments for and against, and what our recommendation was. We interviewed numerous people, proponents of the measure. We interviewed doctors, we interviewed attorneys. The main opinions in favor of the measure were that abortion is a moral wrong to many people, and that spending public funds on this is something that people in the state should not be forced to do. This is a controversial issue, and that these funds shouldn't be going there. Also, this didn't prevent the abortion services from being provided, just prevented public funds from being used. And many of the arguments, I will say, did tend to come back to that. So not to cut them too short, but that was much of what it was that we found. Is my mic? One of the big concerns of the committee was that if the measure were to pass, it would have a disproportionate effect on lower income women, lower income families, and in particular families of color. The ban would be 5.5 times more likely to affect women of color, and would basically create a two-tier system where people who could not afford these services would be affected. People who already could, who had private insurance, would not have a problem. There would also be a two-tier system for public employees versus employees of private institutions. Basically, no public employee would be able to get abortion services paid for through their insurance. One other effect we found is that, according to one study, 30% of the women who would have sought abortion services that were publicly funded would end up carrying their pregnancies to term. This does carry an increased cost to the state, but also shows that 70% of the abortions that would have been thought that would be affected, at least monetarily, by passage of this, would still actually end up happening. So in terms of its effect on the number of abortions in the state, it was kind of a blunt measure that didn't really drive at the heart of it. Also, for those that did happen, it would be likely to create a delay in seeking of care. That delay can cause further medical problems and further social problems. There were many social problems, impact on women's poverty rates, the ability to get a lower cost services if they're going to get the services anyway, that would be brought about by the delays while women were seeking funds to privately pay for their abortion services. We are also concerned about the ban exceptions. As I mentioned before, the initiative petition had an exception for to save the life of the mother. It did not for health. It also did not for things like mental health, addiction, fetal abnormalities, which would include terminal abnormalities. All of these would not be able to be relied upon to provide an exception. It does provide for exceptions as provided by federal law, but those are statutory in nature and could be revoked at any time. Because I am about up with my time, I will finish now, and I move that the City Club adopt our recommendation that no on Initiative Petition 6.
Prior to today's debate, members wishing to debate signed up at the report table. In the interest of fairness and our limited time to address 9 reports, members were selected at random from among those signed up to speak for or against Initiative Petition 6. I will alternate between the 2 positions. Each speaker will have 1 minute. The parliamentarian will help me rigorously enforce our 1-minute rule for member comments at the microphones by flashing a 15-second warning card indicating that time is running out, and by ringing the bell when time is up. The microphone to my far right is labeled yes. Is that true? Okay. For those who support the petition's effort to ban public funding of abortions, and the one to my far left is labeled no for those who oppose the petition. Will the following members please line up behind the yes microphone? We did not have any members sign up to comment. Will the following members please line up behind the no microphone? Brandy Tuck and Erica Hiller.
Should we? Okay, there it is. Awesome. Oh. Hi everyone, my name is Brandy Tuck. I am the Executive Director of Portland Homeless Family Solutions and a City Club member. And I sat on the Public Funding for Abortion Research Committee, which was a wonderful experience. I think that I definitely agree with the committee's recommendation to vote no if we were to have this kind of measure come up on the ballot sometime again in the future. I think the biggest thing for me is someone that works with low-income people on a day-to-day basis, that this measure so disproportionately affects low-income women and their families and women of color and their families is a really big red flag for me, and something that I think that our community should really think twice about before allowing to happen. We have a huge disparity in the percentage of populations of color who experience poverty in our community, and I think this is just one more step towards continuing to make sure that they don't have the chance to get out of poverty. I think the other thing that was really important for me was that this is a big privacy concern. I think that the decision whether to have an abortion is a huge decision to be made in consult with your family, your doctor, and your religious or spiritual counsel if you want it. And the state should not weigh in on that decision. And by banning this kind of public funding, then the state does weigh in and has a decision in whether or not, or has a stake in this decision whether or not that you have this decision to make for your body. And that's it. Thank you.
I'd like to make a point of clarification just so we're clear here. If someone is standing by the yes microphone, that means that they are in favor of adopting the recommendation of the committee. If they are at the no microphone, it means they are not in favor of adopting. Yes.
It's okay.
Yes. All right, so
No.
we now have, we do have a last-minute sign-up on the no recommendation, and that is Muriel Lezak.
Okay, and a city club member. And I was on the committee, and I took on the responsibility of finding out what the people who were proponents of this measure, what they were thinking. So I'm going to say a word or two on their behalf, not necessarily my behalf. And that is, I think that the kernel of their concern is that by forcing them to pay for abortions, it is forcing them to violate their religious principles. I think that is the core issue, and that they feel that this is contrary to their constitutional right to freedom of religion, freedom to be able to practice their religion as the way they see it. But that's the core, and it is a point I think that people should be aware of when we're voting one way or the other. Thank you, Ted.
Hi, my name is Erica Hiller. I'm also a City Club member and sat on the research committee along with the others who have already spoken. And I just think to add a couple of points. We did a pretty broad view of literature review and looking at various studies of effects that have happened in other states. And amongst the rigorous studies that we looked at, I mean, there was a real strong evidence to show that families were pushed with unplanned and unwanted pregnancies. They were pushed into deep, deep poverty. There's, in fact, a really comprehensive 5-year study that is ongoing right now, I think out of UCSF, if I'm not mistaken. It's called the Turnaway Study. We were able to look at some preliminary information from that, but the whole study is still ongoing. But I think that that's just one example of some of the really rigorous data that's out there that just shows the impact upon families. And as Ryan mentioned, the impact upon public employees not being able to have that choice in their health plans. And 15 seconds left. And I want to say, too, one of the things that resonated with me was the intrusion of government into the kind of a private decision. Like if they did have just exceptions for rape and incest, then the burden of proof would be put upon a family. So like right now, that is not something that is in the decision-making process. But if that were law, anyway, that's, thank you anyway for the quick 1 minute. I tried to talk quickly.
Thank you all for your comments. The debate has concluded. We will now proceed with the vote on the motion to adopt the report, which recommends a no vote on Initiative Petition 6. A simple majority vote determines whether or not the club supports the report. The final tally will include ballots cast in person today and ballots cast online between August 21st and August 25th. The results of all votes will be announced online on August 26th. If you wish to vote today, please indicate your vote on your ballot at this time. As a reminder, if you turn in your ballot before you leave today, you will not receive an email ballot. Thank you to Ryan and to the committee for their hard work.